My name's Steve Erickson, and I'm an associate professor and a clinical pharmacist at the University of Michigan College of Pharmacy. I'm a passionate supporter of Theresa's Law, and I'm here to share why I think this legislation is so important to me and to others. I've witnessed firsthand the challenges faced by residents who live in group homes and assisted living settings and the impact it has on caregivers and families. In my clinical practice, where I conduct comprehensive medication reviews, either in a person's home, such as a group home, or over a Zoom session, I've documented numerous issues with medication management that, if left unchecked, may result in harm to the patient or to the resident. Most of the time, these issues stem from staff either not paying attention or staff not understanding the medicine itself. This is called health literacy or health numeracy, where they don't understand the directions for use on how to actually help that person administer a drug or administer it to that person. I've seen inappropriate techniques such as poor inhaler use. I've seen extended release medications that should never be crushed, being crushed and administered to people. These are all problems that can lead to inadequate treatment and potential harm. On a personal note, my wife and I have 4 adult children, and our oldest child, Christopher, has Down syndrome. Chris lives in a supported environment in an apartment about a mile from our house. We have ice cream every Thursday night, and it's around medication pastime in the evening. And I noticed the staff member preparing my son's evening medicine. Now, at the time, my son was taking a liquid medicine, and the dose was for 5 milliliters, and it was to be pulled up in an oral syringe. The staff person I observed pulling it up into a 20 milliliter oral syringe, the full 20 mLs rather than the 5 milliliters. He was about ready to give it to my son, when I intervened, and I said, "What's going on here? How did you come up with this dose?" He said, "I don't know what 5 milliliters means, so I just give 1 syringe full." And I realized this person didn't know how to interpret a lot of directions. This is a health literacy and a health numeracy issue. I began to realize that these problems I study in large populations were occurring right here with my own son. Theresa's Law addresses these critical issues. Theresa's Law includes important provisions such as more comprehensive staff training and oversight, consistent oversight of that training and the management process by a nurse or a pharmacist. It is also imperative that we make public an agency's policies and procedures and documented issues such as medication errors to enhance accountability for facilities and agencies. These changes are essential to ensure that our most vulnerable citizens are treated with dignity, respect, and high quality care that they deserve. I urge legislators and state leaders to take immediate action and support Theresa's Law. Legislation like this will make a real difference in the lives of residents and families across our state. Let's make sure every individual in assisted living settings, adult foster care, and in group homes are well cared for and respected. Please support Theresa's Law today.